Welcome everyone, Dylan Gemelli here today with a brand new video for you. So today we're going to talk about testosterone replacement therapy. But before we get into that, I have to reiterate that I am not a doctor. Anything I say in these videos is for your entertainment purposes only. What you do with this information is completely and utterly up to you, and I am not advising nor condoning you to use any of the things that we discuss in any way, shape, or form. So let's get into testosterone replacement therapy. I'm going to focus on a few different angles here. Obviously, I'm going to explain to you what it is. And then we're going to talk about, who should be on it, who shouldn't, some of the ways that it's abused, things of that nature. So, testosterone replacement therapy is just what it says, all right? You are getting actual testosterone put into your body because you are suffering from a low testosterone condition or hypogonadal condition, meaning your body is not producing a healthy amount of testosterone on its own. Now, generally speaking, but not 100% of the time, you're going to see, men that are a little bit older going through this issue, if it's been on a natural case. However, there are instances that I have seen of men, or even, I would say, young adults or young men, whatever you want to call it, people in their 19, 20, 21, 22 that have never done steroids, never done anything. Sometimes it's been caused by accidents people have been in. Sometimes it's just whatever Mother Nature decided in terms of your bodies, but the conditions are developing, at a much younger age. But a condition is a condition is a condition. No matter what caused it, it's still a condition and it's still something that needs treated. Obviously, if you're abusing steroids, especially at a young age, you're more likely to be on this at a much younger age, and definitely more likely to just require it at a certain point in time of your life. Now, one of the things that's going to differ a few, numbers here and there is what the reference range is in terms of high and low testosterone. Generally speaking, you're going to be looking at about 260 to 280 for your low end, depending on where you're going, and your high end, 916 all the way up to like 1030. You can go to some different sites and see reference range posts, different numbers. Private MD labs, your doctor, different websites, WebMDs, all of these. You can go through and look at them, but generally it's going to be right around that area. Now, your doctor or endocrinologist, urologist, whoever you're going to, for your issues will determine whether or not they're going to prescribe you testosterone replacement therapy or not. Now, mind you, some doctors are a lot more quick to give it than others. Some doctors, even if you're at the low range or below low range, just refuse to do it. They just refuse to do it. Now, another thing, just because your testosterone levels may be a little bit lower, you may not be having the side effects that are associated with the low testosterone, hypogonadism, things of that nature. I'm going to give you a few things that you need to look for, in terms of, signs and symptoms. But listen, just because you have some of these signs or symptoms does not mean you have low testosterone. So don't go, Gemelli said that these are symptoms of it. Yeah, but these could be symptoms of several other things as well. I see guys writing me all the time, well, I'm tired all the time. Well, that doesn't necessarily mean you have low testosterone. All right, you need to go get a blood test done to determine whether you have low testosterone or not. There are certain symptoms that could go and correlate with so many different other things. But I am telling you that these are possible signs and symptoms of low testosterone levels. So, as I just said, being tired all the time, lethargy, fatigue, depression, even trouble concentrating. You'll have a lack of focus. Hair loss, losing muscle mass, kind of, unexplainable. Low sperm count, trouble keeping an erection or having interest, or losing sexual desire, things of that nature. Weak bones, osteoporosis, things like that. Now, women can also have symptoms, all right? Fertility problems, low sex drive, menstrual cycle problems, whether it's a skipped cycle, delayed, early, things of that nature, vaginal dryness, and once again, weakening bones. Just some symptoms for high testosterone in women while I'm discussing this. Really oily skin, a lot of acne coming out of nowhere, darkened areas of the skin, a deeper voice, enlarged clitoris, excess hair on your face or your body, or abnormal hair growth where you normally don't expect it, hair loss, baldness, and skipped or no periods. So, basically, a simple blood test is done, all right? It's usually done when you've been fasted and early in the morning. That's when you're going to get the optimal, reading on your testosterone levels. So, and when they're at their highest. You're just going to have basic blood draw done, all right? You need to tell your doctor if you're taking any herbal drugs or any other medicines that could possibly affect your results, anything that you can think of. And remember, testosterone levels will vary from day to day, hour to hour. So if a really high level is found or a really low level is found, chances are they'll want to repeat it just so that you're aware, because there's so many differentiating factors that can go along with this. Okay, so people will ask me, well, what should I dose my TRT at? And these are generally people that are doing it on their own. Well, look, there's no cookie cutter answer for that. What I can tell you is this. If you are severely hypogonadal, and I've seen some severe cases where people are just not responding well even to treatment at a lower dose, then you're going to need a little bit more, clearly. Generally speaking, you don't want to be on more than 200 milligrams of testosterone per week for extended periods of time, especially years or the rest of your life. It's just, the higher you go, the more at risk you are for long-term damage, heart problems, probable things that could occur with your prostate cancer, things of that nature. Am I saying that's going to happen? No, I'm not. I'm saying that you're at a higher risk of it. All right, and the probability is going to go higher. I don't know if those things are going to happen. I don't know if they do, how quickly they will happen, because I am not a psychic. And last I checked, in reality, there's not too many of them out there. But I can tell you probabilities. Now, most people are good to go at 100, 125 milligrams a week, 150 milligrams a week. But each individual circumstance is different. I can't offer you a cookie cutter answer on that because I don't know. I'm not going to sit up here and lie and BS you like some people out there will do, and they'll just go, well, this is the dose you want. Look, that is not reality. It's like giving out a diet and telling everybody to do it. Well, guess what? Everybody's different. All right? So your condition could be different than the next, and the next, and the next. We have to, and if you're going to your doctor, it's their job to monitor you and figure this out. If you're doing it on your own, well, you're taking that risk on your own, and guess what? It's your job to do due diligence and figure this out on your own. Okay? But hypogonadism and low testosterone is a very real thing. It is. The problem is that people will decide to just go do that without doing the proper research and not understand the implications that go along with that, where you're on it for life. And if you do decide to come off of it, you're going to have an extremely difficult time recovering your natural testosterone production, and more than likely you never will get it back to where it once was. I can't say that with certainty either. I can't tell you exactly how to do it because, once again, every circumstance is different. You might want to try an 8-week PCT. You might want to try 12 weeks. You might want to try different combinations. It's different for everybody. So when you ask me these questions and you get an answer back from me that seems like I'm asking a lot of questions or trying to dig, well, I can't give you an accurate answer without doing that. I'm certainly not going to BS people and blow smoke and try to make myself sound smarter than I truly am, because that just shoots credibility down, and to be honest with you, I'm just not that kind of person. If you're going to ask me, I'm going to do my best to help you, but I'm also, I am not an endocrinologist either, and they need to be monitoring you, going over all your, histories and things there's a lot that goes into this besides just emailing somebody or just deciding on your own and going, oh, I just want to do this. That's why I get so upset with all these, certain bodybuilders and meatheads out there telling people, just blast and cruise, just blast and cruise. You don't understand the implications of that. And these guys, you're telling new guys this, or guys that really don't understand, and they're just listening to you because you're big. And that doesn't make you smart. Any jerk can go out and blast a bunch of steroids, eat all day, and get big. That does not make you smart or make you understand what you're doing. Okay? One of the reasons why I don't use them anymore or whatever is to keep a clear head, be more rational, and to be on top of my health, etc. And that's why, I don't even mess with them anymore. I just teach. And teach and teach and teach and teach. And that's what I want to do, is teach, not also be involved in it. So that's testosterone replacement therapy for you. ester-wise, things of that nature, cypionate's generally what's prescribed by doctors for testosterone replacement therapy, although sustanon was also basically designed for that as well. So these are good options. But once again, something is to talk about with your doctor. You could really even do enanthate for the ester on TRT. You could do prop on the ester if you want to pin every single day or that frequently, but I really don't recommend that. But it can be done, sure. Just so you understand, testosterone is testosterone is testosterone. Okay, so, but that's testosterone replacement therapy for you. I'm sure I'll touch on this more in other videos and do different types of videos on it as well. So that being said, www.isarms.com/forums. I'm also on the evolutionary forum as well as the elite fitness forum. You can also email me, dylan@isarms.com, and please don't forget to subscribe to the channel. That being said, stay tuned for plenty more to come. Dylan Gemelli signing off.